Hey everyone, it's Erin. Welcome back to video number 3 of our intervention series on integrative manual therapy. I sincerely hope that if you watch these videos up to this point that you're getting a lot of great information about this awesome new program that we're offering at Diversified. Today's topic is instrument-assisted soft tissue mobilization. So if you remember from our video from a couple weeks ago, we talked about soft tissue mobilization and how it's a therapeutic tool we use all the time with our hands to help break down adhesions, improve muscle function, reduce pain, and improve mobility of our patients. The difference between what we talked about a couple weeks ago and today is now we're talking about how we can incorporate stainless steel instruments to perform the same task. So these instruments are used in place of our hands to kind of get deeper into the muscle in a way that our hands cannot, and really help to break down those adhesions, scar tissue, and do it in a little bit more aggressive way. So Ashley, come on over. Dr. Ashley is back. So we are going to pretend that Ashley has a hamstring injury. Let's say that she is a runner and she's been noticing that she's having a lot of pain and tightness in her hamstring and that she's not able to run in a way that she was normally able to do because now she's restricted. So after my assessment, I'm going to take a look at her hamstring. I'm going to kind of feel around, see if I can feel where the tightness is, see if there's any knots that I want to take care of. And the first thing I'm going to do is try to warm up the area. So just like we would put heat on a tight muscle, it's beneficial before we start to either actually do some warm-up exercises, whether it be on the elliptical, the treadmill, or just putting a heating pad on her hamstring or wherever the area of the body is to try to loosen up the muscle, relax it, and get the muscle in a better position for the treatment we're going to provide. The next part of it, after we warm up the muscle, is to perform the instrument-assisted soft tissue mobilization. So on her skin, I'm going to put, similar to what I did in our video a couple weeks ago, an emollient or a lotion on the area that we're treating. This is going to help reduce friction with the tool that I'm putting on her skin and make it a little bit more comfortable for her. Okay? So as you can see, we have our tools here. There's 3 of them to choose from. What's great about the tools, as opposed to using our hands, is they're contoured in such a way that you can get a little bit deeper into the muscle, like I said, but they can form to different anatomical positions on the body because of the curves that they have. So for Ashley's hamstring, because it's a larger area, I'm going to use this tool here. So there's different ways I can grip it. So we have the concave portion here and the more convex portion here. For Ashley, I'm going to use this side, okay? So I'm going to apply a little bit of pressure. Again, this allows us to get deeper into the muscle, and we're going to go slowly all the way up. So again, Ashley, can you feel this? Mm-hmm. Is it tolerable?
Yes.
So you want to make sure that it's comfortable for the patient. They're definitely going to feel something because, as you can see, we're digging into the muscle because we really want to break up any adhesions that are there, because the tighter the muscle is, the harder it is and the more uncomfortable it is to move. So this process we'll do for about a minute or 2 after we've heated up the muscle. And I'd be checking in with the patient, in this case Ashley, just to make sure that everything's feeling okay, she's not too uncomfortable. If I do find a spot that kind of feels like a muscle knot, I would kind of maybe flex in that area a little bit just to try to break it up to her toleration. Okay, and we can really do this to any area of the body. Neck, back, biceps, forearms, feet, anything that feels tight, we can use these tools in some way to help with your recovery. After we do this, I would have Ashley stretch out her hamstring to help elongate the muscles further. Now that we've broken up those adhesions and loosened the muscles, we're going to try to help her to increase her flexibility by loosening up her muscles by stretching. And then I would probably have her do some strengthening exercises to see how everything's feeling, and then maybe apply some ice at the end. Similar to cupping, it might cause some soreness. I mean, these tools are definitely digging deeper into the muscle, so soreness is going to be expected, so nothing to worry about there. But that is essentially how our instrument-assisted soft tissue mobilization works. Thanks for watching, guys, and I'll see you next week. Bye.